the way a contact tracing app works is that when the app is installed on multiple users' mobile phones, the apps record proximity as the people with the phones come into proximity with each other, and record a memory of anonymous IDs of the phones that they've come into contact with, such that if a person at a later date becomes symptomatic with COVID or diagnosed with COVID, a notification can be sent anonymously to those people who've been identified as being at highest risk of having potentially acquired infection, and then enables public health messages to be passed to those individuals, such that they can reduce their contact rates, such that they can avoid transmitting the virus to other people, particularly to vulnerable people. And if they're a contact of a confirmed case, there is a possibility of asking a quarantine, just as is done with manual contact tracing. So the app solves the problem of how you get the message to the person who might be infected before they become infectious and before they become symptomatic.
The way it will work is people's phones will keep a record of the anonymized tokens of those they've been in touch with. That data will stay on people's phones until such point as they become symptomatic, when they will have the option to give us the list of those randomized IDs of those they've been in touch with. That will allow us to do the cascades of warnings that Christoph has talked about. It will also allow us to see the wider contact graph of how the risk is propagating more widely, what the contacts are between people, be it on an anonymous basis. But just to be clear, what we have is identifiers rather than identities.
Yeah.
And the data sits on people's phones until they choose to share it with us. So there are a series of protections that allow people to be confident in using it, that their privacy is being protected, even as it allows us at the same time to hone the algorithm and develop a more sophisticated risk model.
Thank you. So you're going to the macro level then. Is it feasible to expect 80% of all smartphone users, so around 55, 56% of the UK population, to use such an application? You've just talked about some of the privacy fears, surveillance fears, also increasing anxiety if you have an app like that. How would you propose to encourage and incentivize uptake of the app?
The message needs to be, if you want to keep your family and yourselves safe, if you want to protect the NHS and stop it being overwhelmed, and at the same time we want to get the country back and get the economy moving, then the app is going to be an essential part of the strategy for doing that.
In scenarios that are relatively pessimistic with respect to what other control measures are in place at the same time, we found that if roughly 60% of the population, use the app, that would be enough to bring the reproduction number below 1 and control the epidemic. But that would be not just downloading the app, that would be adhering to instructions, which, it's a public health intervention. It would be asking people to self-isolate and then potentially to quarantine for people of time, for an amount of time. And we think that would be greatly enhanced by sort of good relationship of that system with manual contact tracing, such that people could understand, and reinforce the messages of adherence. But those numbers will depend on what other interventions are there.
Mr. Gould, when will the app be ready for deployment?
It makes sense to see how it might work locally before going nationally. So I would hope we will be ready in the next couple of weeks to look at it in a sort of controlled and relatively smaller environment before scaling up.
When do you expect it to be available for mass deployment?
Subject to it performing in the trials and the smaller area in the way we expect, I would expect it technically to be ready for a wider deployment in 2 to 3 weeks. But whether it is then deployed is, it depends on the wider strategy. There are a number of non-official symptom checking apps around, some of them providing actually very helpful data and advice into the system. And we've set up a mechanism where we can take in the data that they've provided, and it's been highly useful. The Ask Zoe app being one such example. In terms of contact tracing, though, I think it is important that there should be one contact tracing app, which will be the NHS COVID-19 app. Because if you start to get a proliferation of different contact tracing apps, then it immediately fractures the population of people who have apps, and it stops being effective. We need one NHS app, which we need people to get behind and download and use. And we need to get the largest number of people to do that, which means, I think, being clear. And I think Google and Apple and the app stores have been clear about this, that for contact tracing, it should be the offer to the public should be the app developed by the public health authority in the jurisdiction concerned.